Hello everyone, welcome back. I am Izuchukwu. Today's video is a Q&A on Uvea related topics. Question 1. Which regions of the uvea is the largest? The uvea is composed of 3 regions: the iris, ciliary body, and choroid. The choroid is the largest of the 3. Question 2. Mention the histological layers of the iris. The iris is divided into 4 layers. The surface layer is the anterior border layer. The surface layer is followed by the layer of the stroma and sphincter muscle. Posterior to the stroma is the layer of anterior epithelium and the elector muscle. The most posterior layer of the iris is the posterior epithelium. Question 3. What are the differences between iridectomy and iridotomy? Iridectomy and iridotomy are 2 surgical procedures performed in cases of glaucoma by making an opening in the iris to facilitate movement of aqueous humor from the posterior chamber into the anterior chamber. Their differences are as follows. In iridectomy, tissue is removed from the iris to make an opening, but in iridotomy, opening is made in the iris without removing iris tissue. Another difference is that in iridectomy, opening is made with the use of sharp instruments, while in iridotomy, opening is usually made with a laser. And lastly, in iridectomy, sphincter muscle can be affected, whereas in iridotomy, iris muscle is usually not affected. Question 4. Describe how posterior synechia can lead to high intraocular pressure. Posterior synechia is the adherence of the iris to the anterior surface of the lens. If there is a posterior synechia that involves a large portion of the pupillary margin, this will cause aqueous humor to accumulate in the posterior chamber, that is the area between the iris and the lens. The continual production of the aqueous will cause the pressure in the posterior chamber to increase, which in turn causes the iris to bow forward in a condition known as the iris bombay. The bowing of the iris presses the peripheral iris against the trabecular meshwork, potentially obstructing the aqueous outflow, thereby leading to an increase in intraocular pressure. Question 5. Cells and flares in the anterior chamber can be an indicative of what? Cells and flares are whitish floaters that appear in the anterior chamber when there is an inflammation or infection of the uvea. Question 6. What are cells and flares? Cells and flares are leukocytes and immune factors released to fight microbes. Question number 7. What causes cells and flares? Cells and flares occur in the anterior chamber due to a breakdown of the blood-aqueous barrier in inflammatory conditions. That's it, guys. Thank you for watching and see you next time.